Hi everyone, thanks for tuning in to Health Matters. I'm Kelsey Meehan with Alberta Health Services. I'm here today speaking with clinical exercise specialist Lisa Serrato, and we are going to be talking about the importance of exercise and exercising properly to maintain a healthy heart. Thanks for joining me, Lisa.
Thank you for having me, Kelsey.
So can you tell me a little bit about why exercise is so important to maintaining a healthy heart?
Our heart is really an amazing muscle. We can, it can pump 5 liters of blood per minute. It beats 100,000 times a day. So it really is the most important muscle that we have in our body. Just like we have to exercise and try to build up our biceps or our glute muscles, the heart is just as important to work and strengthen so that its ability to pump blood is more efficient and safer for your body.
Okay, can you suggest some ways or some things that people can do to get started with an exercise routine?
Absolutely. The first thing that people should consider is that maybe they need to talk to their family doctor. Some people are actually on medications that have a profound effect on exercise. So by simply having that conversation with your physician, you can simply clear up if there is any additional considerations that need to be met. In addition to that, if you're planning on doing any activities that involve a little bit more heavier or a vigorous component in nature, I think it's a good idea for you to speak with your physician and make sure that they are aware of that.
Okay. What types of exercise are best for your heart?
So typically I like to tell people whatever floats your boat. If you want to do cartwheels for 2 hours, then great. But when we break it down and we think about it, aerobic exercise or cardiovascular exercise is how our heart and our lungs work together to efficiently move oxygen to our muscles. So that's going to give us our best benefit. So that would be activities like swimming, walking, cycling, jogging, involving the larger muscles in our body. In addition to that, we also want to think about strengthening activities and stretching exercises as well.
And what tips do you have for people who want to exercise and get fit that are living with various heart conditions?
So if you've already been diagnosed with an existing heart condition, the number one recommendation would be to make sure that you pace yourself. Make sure that you're not going over and above what your expectations would be. So doing things by, whether it be using a target heart rate or using that rate perceived exertion scale, making sure you have adequate time for a warm up and a cool down, maybe even a longer time for a warm up, just to allow those heart and those lungs to kind of dilate more efficiently. And really, most importantly, making sure that you're well hydrated and listening to your body. So if you are experiencing any type of symptoms, slowing it down, taking more precautions, etc. And then definitely as we look at this time of year, as the weather starts to change, if you are doing outdoor activities, you want to avoid anything that would be extreme for weather. So extreme cold temperatures, humidity, wind, things like that. Maybe try and schedule your session indoors instead.
Okay, and can you tell us a little bit about the Living Healthy program?
Sure. So the Living Healthy program initially started off as cardiac rehab and diabetes education coming together. Our program now encompasses a variety of other health conditions as well. So we run our exercise programs here in Medicine Hat and in Brooks as well, twice a week. And we offer not just cardiac rehab, but exercise programming for other multiple conditions as well. In addition to that, now that we are working together with Alberta Health Services South Zone, we have been working closely with building healthy lifestyles to sort of share information with one another and generate some relevant programs.
All right, that sounds great. Thanks for speaking with me today, Lisa.
Thanks very much for having me.
And thanks for watching Health Matters, everyone.